Hey guys, welcome back to the channel. Alright, so since I just had something that happened to me where I needed my medical kit and it did save somebody's life, I wanted to do a series of first aid kits, and ideally this is what I pack, not necessarily what you would put in there. There are other people that are medical professionals. I myself, for a profession, are not a medical professional, but I am a first responder trained, so I have medical training for that, wilderness first responder, and also extreme cold weather first responder. The classes that I took mostly were from the American Red Cross. I also have other organizations that train and teach this stuff to good folks like you and I. You don't have to be a doctor to save somebody's life. You actually don't even need half the stuff on this table to save somebody's life. A couple bandages and a good understanding of how the body works and how the body resuscitates itself is more than enough to save somebody's life. However, if you know absolutely nothing, the best thing you can do is get your training. And I know you're going to hear that, you're going to hear me say that a lot, but there's nothing more traumatic than rolling up to a scene and seeing a guy bleed the hell out, and then you're like, well, what the hell do I do next? All right, you're gonna have a brain fart, believe me. So what you want to do is make sure you get your training first before you buy any of this stuff. A lot of the courses will supply you with some type of medical kit. They're either training aids, or you can go and purchase this stuff either from like your local Walmart, Rite Aid, or a lot of the stuff that I purchase is from Amazon.com, and they all have everything in here. That being said, I do have a link below. If you are interested, go click on the link below, and I put almost 90% of the stuff in here on my Amazon store, and you can pick and choose the stuff that you like. Alright, so a little bit about me. I've been in Marines for 10 years and probably a security contractor for another 10 years, so I've been in the know as far as taking fire, returning fire, and of course plugging wounds, or providing first aid. Most of the first aid that I provided while I was in the military was for my feet. You're going to get a lot of that. You're going to get a lot of blisters. You're going to get a lot of cuts. Guys cut themselves. Everybody has this big rolling joke of the Marine Corps K-bar knife is for it's the MRE opener. Okay, mostly it's a Marine opener because they always slip and cut their fingers. But in any case, I digress. The first aid stuff that you're mostly going to use is boo-boo ouch stuff. Okay, yeah, you might need some stitches, or someone gets road rash or something like that. When you come upon a scene where it's either a car accident, an IED, some freaking crazy guy shot somebody, something of a traumatic or trauma event, you're going to need more than that little first aid kit. Now, what I mean by that is that most people have this in their car. Okay, this is just the Johnson & Johnson first aid kit, and this is what I call level 1. You can buy this at your local Walmart, your Wally World, and it has a couple bandages, mostly for fingers, and boo-boo ouch stuff, and some sterile stuff in here, and maybe these really cheap plastic splinter removers, and a pair of gloves. Okay, nothing extensive in here. Probably cost you about $12. You throw it in your car and you figure I'm good. Well, most of the things that I've come across that are in car wrecks, this probably ain't gonna cut it. I think you got maybe a 2x2 gauze bandage and maybe like a 4x4 in there, and that's it. And the tape that they give you is usually pretty crappy. So the stuff that you see here is the contents of some of the things that I would pick to put into my first aid kit. Again, like I said, this is for field trauma. Okay, it's not hospital. We're not doing surgery on the side of the road. This is for things where people are in need, especially your families. If you have somebody that is a family member and is diabetic, you'll have certain kit for that. If you have somebody that maybe has an amputated leg or whatever the case, or has higher allergies, you'll probably carry more of those medications. I should say myself that as a first responder, I cannot administer any type of drugs except for certain ones, and I'll go over that in a second. there are certain things that you can do and you shouldn't do. If you are uncomfortable with a procedure, the first thing you should do anyway, if you come upon a scene or an accident, is call 911. Hopefully they'll get there in time. What you want to do is make sure that that person is breathing. Make sure that they're awake if they can. If it's unconscious, then you got to start checking things. Also make sure they have a pulse, okay, obviously. I'm not going to go into all the training methods there. A lot of people will go into shock, and you can talk about that for days, but the stuff that you see here is some of the things that I think you should have in your medical kit, and without further ado, I want to kind of jump into it, alright? Again, this is stuff that I would carry. It doesn't necessarily mean it's everything, and it doesn't mean all of this, okay? This is a lot of stuff. If you don't have the money for this, buy it in piecemeal. That's it. Alright, so I'm going to start over here from the left. Most of the problems that I run into are usually at night. So what I tend to carry is a headlamp. This happens to be a Petzl. It could be any headlamp you want. Also, I carry snap sticks or chem lights or something like that. Make sure you check the dates on these things because they can get pretty old. This happens to be orange and green. I also carry a pen light. This is a pupil dilator pen light to see if the pupils are dilated. I don't know if this, yep, that one still works. I know a lot of people use better flashlights than these. However, you don't want to use something too bright because then you start blinding the patient. The thermometer, this is a cheapy thermometer. I'm probably going to replace this, but this is a digital thermometer. Something to take the patient's temperature. You know, again, a lot of stuff could be boo-boo ouch stuff, like your kid has a fever or something like that. I always carry a couple of Sharpies. I don't know anybody that would not put any type of writing implements in their kit. Sharpies seem to work. They'll write on skin, they'll write on paper, plastic, whatever it is. Okay. I always carry my first responder Emt book. This one is a pocket reference, and it has pretty much everything in there that I would need as far as reference material, even pregnancy and birth. I have not yet had to perform any type of birthing stuff on the side of the road, but I was there to see my son born, and I gotta tell you, holy crap, that's a lot. So I hope I never have to do that in the street or on the road. As far as tourniquets, I want to talk a little bit about tourniquets. The tourniquets that I like to purchase are the cat tourniquets. I know there's a lot of fakes out there. This one happens to be by Recon Medical. It does come with a bag in it, and this one I have to take out and set it. I know a lot of people are going to comment on that, but what you got to do is you got to take it up and set it ready to go, and then this way when you pull it out of your bag, you can just strap it on. You don't always need, it's not always going to be one tourniquet. A lot of people carry one tourniquet. Ideally, if it's like a leg wound or something like that where it's amputated or something's off, you're basically creating a crush injury in order to stop the bleeding. And yes, it's going to be damaging the tissue and all that other stuff, but honestly, if the guy bleeds out or the girl bleeds out, it won't make a difference because they're dead. Some people carry these. These are the SWAT T tourniquets. This one is an orange. I like the color, and if you could get these in orange, and I think you can, I would definitely try to get them in orange, just because it's easy to see. And as soon as you show up there, a bright orange thing, the doctors would know. Make sure always that you mark the time with your Sharpie. You can either mark it on the tourniquet itself, it has this nice little time stamp here, or just write it on their forehead like we were trained in the military. Just put it on there, put a nice big T on their forehead, and just put the time and date on there if you can at the time. These are stretchy, they're very compact. It tells you how to put them on, and you could put them on yourself, but basically it's just a big wide rubber band. And I don't know if you can get them as tight as the SWAT T or the soft T tourniquets. I have not used these yet. I have not practiced with them. Most law enforcement and military goes with the cat tourniquets. All right, so they're not cheap. They're about $30 a piece, but make sure you get the real ones. CPR mask. The books are now being updated to where they're stating that CPR masks are, or actually the breath, when you take a breath, breathe into your lungs is less necessary nowadays. Okay, so you have a mask here. They have the mask kits for the infants as well as the adults. This happens to be just the adult size. If you come to a scene and someone's unconscious and they're not breathing, you can do chest compressions. Obviously, make sure you check everything out, but you're going to need something that is a barrier. Okay, they sell the pocket ones that are just like little tiny envelopes, and that'll do you just good. It's fine. That'll do you just as well. And ideally, if you ever done CPR, sometimes if you blow too hard, you'll wind up either blowing crap out of their butt, or they'll if they have vomit, they'll vomit up into your face, which is not something that you really want to taste on a patient. Before I get into the trauma bandages, these type of bandages, this one's pretty old, that's why I took it out. This is supposed to be a petroleum dressing. It is sterile, non-adhering. So what this is like, if you have some type of cut or wound that you don't want it to stick to, this is sort of like the old school way of doing it. They would use like a petroleum dressing, and then of course I also have petroleum gauze, which is ideally the same thing. A lot of times what happens is when blood coagulates, it'll stick to the dressing itself, and it will be very painful to take it off. A lot of times you have to cut it out, and it's just a huge mess. I do recommend the Halfland chest seals. Alright, they come in a pack of 2. They are not cheap, but I like the fact that it comes in 2, one for the front, one for the back. So if you do come upon someone that is shot, look for the entrance and exit wound. Exit wound is going to be a lot bigger, so it should be a lot more noticeable. I have 2 of these, and I also have the this one might be North American Rescue. North American Rescue makes both of these, so these are excellent. Try to get the one with the valve. There are ones without valves. The idea behind it is that the lung pressure and everything, that if you get hit in the chest, it's like a balloon, and when a bullet goes through it, it deflates. So you want to cover that wound so it actually has it actually can start working again. All right. As far as the trauma wound bandages, these are worldwide distributed. This is the Israeli bandage. I'm not going to take this out. Highly recommend these. These are awesome. They come with there's so many ways to put these on, but it does come with like a pressure, I forget the name of it, but it's like a pressure clip in there. And what it does is you can tighten it down, and it'll actually put pressure on the wound. There's a certain way to do it. You have to roll over first, put it through the clip, and then pull it back the other way. And there's a clip on it, and you can actually use it as a tourniquet if you needed to. Maybe not as much as one of these, but it'll definitely do its job. And they sell them in 4, 6, and I think they even have the abdominal one that has a 12-inch. So if you get lacerated in the belly or something like that, these are definitely worth their weight in gold. I think they're like $7 a piece, so they're not cheap, but see if you can get them on sale. And make sure you buy the real ones from Israeli bandages. Don't buy the fake ones, because they're crap. This happens to be a Vietnam style trauma bandage. Now it doesn't have all the fancy gadgetry that the new Israeli bandages, but it will work. It is a trauma pad. It's a 4x6, and it does have the wraparound pieces. I like these because they are thinner. As you can tell, they are thinner, and you can pack more. Depending on where you are, depending on how much time you either spend on the road or in violent neighborhoods, it depends on how many of these you're going to pack. I always like to have a couple extra, whatever I need. Okay, I don't really, just throw as many will fit in the kit kind of thing, because those things will definitely save a life. I always go with a nice sterile 4x4. All right, these are not expensive. They're very cheap. This happens to be the Rite Aid brand, and you buy them in boxes, and you can buy them on Amazon. Again, a lot of that stuff can work for either boo-boo ouch stuff, or it can work for major trauma. I always carry some type of sterile wrap or gauze bandages. This is the Conforming stretch Gorge bandage. It's a 4-inch by 75-inch, whatever it is. So a lot of times what happens is you will come upon a scene, or whatever the case is, somebody's getting hurt, someone's bleeding, and the tape doesn't stick. Well, I'll tell you what, any type of wrap will work in that situation. If you have the gauze, use it. You can also use this if it's a real big gaping wound. You can take the whole sleeve out and just stuff it into the wounds, sort of like a cork, and plug it in. So that works really good, other than trying to get the little 4x4s in there. As far as blood goes, again, I like these the best. These are the extra absorbent. These happen to be 5x9s. They come in different sizes, 7 by whatever, and they work great. They're very slimline. It's basically a gauze sponge, which is awesome. So I always keep a bunch of these on me at all times in any kit. Again, abdominal pad. This is the 10x30. You can buy these on Amazon. A lot of people use these for, I think when you get older and stuff like that, they use them as bedpans and such, so you can buy them in cases. But what I use these for is an abdominal wound. I don't know if you ever seen like Saving Private Ryan or whatever the case is, the guy's guts are all falling out, stuff like that. In that case, you would use these. You would not bother with something this small. You need something big enough to cover that area and make sure no more debris or no more guts fall out. So that kind of works great. And like I said, you can also buy that on Amazon. All right. A lot of people are going to talk about Quick Clot. I'm a big fan of Quick Clot. I know there's a whole bunch of other companies, Cellulox and all those other companies that sell this type of stuff. I don't like the sponge as much as I like the gauze, but the sponge tends to be cheaper, it's smaller, and you could really like pack this in. Now I know that Quick Clot came up with a better chemical solution inside of their bandages, and it's brand new and it came out, and they're giving it to all first responders. It's freaking awesome. Something works on like a natural level. See if you can find that. I forget the word, but it's pretty awesome. Alright, as far as other bandages go, I know there's a lot of people that look down on Ace bandages. I don't know why. I think if every EMT in the country carries Ace bandage, you should carry one or two. A lot of this stuff happens when I go hiking. People twist ankles, they fall down, they twist a wrist or sprain a finger or something like that. And I always have this. You can also use these in many other ways as a cravat or something like that. And you could just give them to your kid to play with because they make little cool Nerf softballs, you know, so just make sure you take the metal pieces out. As far as tapes go, this happens to be the non-adhesive tape. Excuse me. So basically it just adheres to yourself. It sort of works on the same principle of the Ace bandage, although this will actually stick to itself. As far as tapes go, I really like duct tape. This is a very small roll of SOL duct tape. You can use this for so many things. It doesn't have to be just for trauma. You can use it for your tent, if you need to repair your tent, your boots, cuts. I've used this for, like I said, when I was doing a lot of military marches or humps, my skin would just peel off. So what I would have to do is, before I would put this on my feet, and it gives it sort of a barrier, and duct tape doesn't come off very easily on skin. There's two different types that I kind of use. This one is I think they call it the Transfor. So it's plastic, but it has all these little airway vents in there. This works very good. It also makes it very easy to rip. So if you need to make like butterfly stitches or any type of stuff like that, you can use that. And this happens to be the paper, or the I forget the name of it. It says micropore, whatever. I'm not really sure, but it's sort of like the paper version of it. This works pretty good. The problem that I have with a lot of tapes is that it just comes off. I mean, you're bleeding a lot, or there's a lot of liquid, or you tape it on and you go into the water and it just, that's it, comes right off, and then the bandage and the whole wound is exposed. So try to find the one that works best for you. Duct tape seems to work the best for me, so that's the one I mostly use. Okay, couple different meds. Now when it comes to medications, this is all going to be personal. I know everybody's like, oh, you gotta have the first aid cream, the burn gel, and this and that. Okay, well, yes, but you also have to understand that all these medications at some point in time, they will expire. So what I like to do is I buy like a big one of these, and I use some of my old pill things, or I get like a plastic bag and I dump them in, and I just write the name and the date on the little plastic bags. These things are extremely convenient to have. So like liquid Band-Aid, Visine, some chapstick, Tylenol, ibuprofen, all this little stuff is like, again, in the level 1 kit. Always some Tums, you know, because you go to a barbecue and sometimes the stuff just doesn't agree with you. Any type of, if you're allergic, get something that will help you with your allergies. Hand sanitizer, of course. Vaseline. Now here's the thing with Vaseline. Vaseline works in a lot of great applications, but it's not water soluble. So what I'm going to replace this with is I'm going to get like some surgical lube or something like that, because it's water soluble and you can use it for multi-purposes. This is multi-purpose as well. Again, it's Vaseline, but it's oil based. Again, little silly stuff like you know, sun protectant, and this is really good right here. Get something with cortisone in it. Okay, I don't care what brand it is. Basically what it is, it's hydrocortisone. Okay, it numbs the area, it cools it off. Bee stings, stitches, anything that you're going to use that will numb a certain area, try to get the stuff that you can. Like, they're not going to give you the pharmaceutical version of it, but it's, you know, you can buy it in Rite Aid or Walmart, and that seems to work very well. Anti-diarrhea meds, obviously. Any type of antiseptic wash works good. This, again, this is the Band-Aid brand. A lot of times if you have kids or whatever the case is, they usually wind up scraping their hands or knees or something like that. You need something to wash it out, and this happens to have I believe lidocaine hydrocortisone in it. So not only does it clean, but it numbs the area. This is more of a first responder type kit. It does the same thing. It's a sterile wash. It's really good. Like if somebody has something in their eye, you can also wash it out in their eye, that type of stuff. I've always used just regular H2O with somebody that had a something in their eye. You just turn them on their side and pour some clean, fresh water through it. All right. Before finishing up with the Band-Aid stuff, I'm going to tell you that honestly, these little kits are my level 1 kits. You can see there are multitudes of Band-Aids, sturdy strips in here, regular Band-Aid sizes, finger Band-Aid sizes, knee scrapes, that kind of stuff. This is primarily what your kit is going to be used, all this. Again, if you wanted to add some first aid cream, burn cream, Neosporin, alcohol swabs, all that stuff is going to be in here. Iodine, all that stuff is going to be. So these two kits are primarily what are going to be used all the time, especially when you have children. I always make sure that this is somewhere in this kit, very accessible, readily accessible. All right. So I want to talk a little bit about what is this? NPAs and OPAs. Okay. Basically, this is the military version. All right, I have to upgrade these, but the size 28 seems to be the normal size for regular adults. Some of the stuff is expired, but again, this is still usable. I just have to get some lubricating jelly or surgical jelly. These are one of the things where if your patient's mouth, or he's not breathing for whatever case, his mouth is destroyed or something like that, you have to get airway into his lungs. There is only one place that you can get air from, well, not surgically speaking, but first responder speaking, is through his face. So if his mouth's destroyed or his nose is destroyed, there's some way that you're going to have to get air through his lungs, or her lungs, I say his. There are many kits out there, but again, these procedures are a little bit advanced. If you are someone that is an EMT, someone that might have to do this, that's fine. They come in different kits. This is the OPAs. These have different sizes, but I just want to show you what it looks like. Okay, something like this. All right, there's techniques on how to put these in. They are not comfortable. They can choke your patient. They can actually kill your patient if you're not watching them. And it's a very advanced procedure. This is hard plastic. There's a certain way to insert it, and if they have a gag reflex or they're semi-conscious, it's going to be very difficult and very uncomfortable for them. So I really don't recommend these so much as this. All right, this is just a little rubber tube. You will need some type of lubricant on there, and it's a little bit tricky to get in. You usually insert it through the right nostril, give people airway. I will say that there's going to be a lot of people that say, well, if he has a traumatic brain injury, you don't want to slip this in through the nose. And ideally it would be, if the guy's bleeding through the nose, if the guy's bleeding through the ears and through the mouth, normally there's probably some type of fractured skull or a brain injury, and you don't want to be sticking tubes through the guy's nose because it can go off on the wrong path and kill the guy. Well, you know what can also kill the guy? Not breathing. So you got to kind of make that judgment call. And again, this is a very advanced, I don't recommend everybody have it, but if you are going to take the courses or you're getting EMS trained or something like that, these things are life savers, okay? These as well, however, I don't like using these, the OPAs, because OPAs, they move around, they're small, and you're jamming a piece of plastic down someone's throat. I really don't like that. But if you didn't have that, and let's say the guy's nose was inaccessible for whatever reason and you had to use it, I always keep it in my kit. Again, very advanced, but highly recommended, at least the NPAs, because if you don't have one, you're not sticking a straw down someone's nose, all right? Gag reflexes a lot of times you can go up on a patient and you can slap them in the eye, and if they blink, that means that their reflex is still working, so they're not completely unconscious. This is like an unconscious type of thing that you would use. That's all I'm going to say about that. Other things, and this is what they started giving out to first responders, is a nasal, this is Narcan nasal spray. Like I said, I don't know if this is readily available to civilians, but it's anybody can use this. It even has directions. Someone that is opioid drug user, such as heroin, cocaine, or something like that, usually have to spot the signs of a overdose or drug addiction. This will save their life. Okay, you cannot overdose somebody on Narcan. You cannot. It's very little, very small. You just give them one shot, you wait a couple minutes. If they're not responding, you can give them another shot. You have to be able to recognize the signs, although if you do give this to somebody, let's say that's having a heart attack, because it won't kill them. Okay, so it's very safe to use. This happens to be the older version of it, which is more of like a syringe type thing, but again, very, very simple to use. You just put it together, and you got the little tip on the end, and you squirt it in their nose. Make sure you document when you gave it to them, all right, so you can tell the first or the EMS or the doctor or whoever responds, okay? Again, this is just a tincture of benzene, first aid medical stuff, great. This happens to be with the wound. And a lot of reason why they use this type of stuff is it's clean in the wound, it's disinfecting, it's not alcohol, so it doesn't sting, and it also adheres the bandages better, okay? So really good stuff. This you can also get on Amazon. They're just in a Q-tip form. All right, moving on. So a lot of other things that I want to talk about is patient care, splinting, that type of stuff. But when you come upon a scene, depending on what time of day it is, what the weather is, I always try to carry a space blanket. You even saw in that little first aid kit, space blanket worked pretty well. These little tiny space blankets in a windy environment, good luck. I mean, it's just not going to work. I usually try to go with the SOL heavy duty blankets, or even better yet, the bivy sacks. If you carry like an extra bivy, it's better off. This is nice and compact and flat, so I don't mind carrying this, but this is like a two-person, even for one person will still work, and it's a lot better than these little emergency blankets. It's bigger, it's easy to clasp around them, and I don't know if you ever saw like the Boston bombing. There was a lot of patients that were just waiting to get transported to hospitals, had blankets, all right, for that reason. Anytime you're in shock, your core temperature will lower. You'll get cold. You're not thinking. You're not eating. You're totally in shock. Things don't work right. So you want to keep your body temperature as warm as possible. Just something quickly before I go over all the tools. I always carry surgical tubing. It's good for a lot of things other than just doing inserting IVs. I do recommend, if you are certified in it, that you get an IV starter pack. They're not expensive. They're about $5 on Amazon, and it comes with everything. It comes with the IV, it comes with the alcohol, it comes with the needle. And for me, when I was in Iraq, we were taught how to give each other IVs, and also gave ourselves IVs so we would know what to look for. Most of the time what will happen is if you're bleeding out a lot of liquids, you want to get the liquids back in there, and drinking water is not really going to work. It's not conducive, it's not fast enough. A saline solution is fast, will work, will get the electrolytes back into your body. Depending on how bad it is, or how bad the wound is, or how much blood you lost. I know a lot of guys that just carry IV bags. I do not have access to IV bags. They do expire. Again, that's an expense. If you have someone that's a buddy, that's a friend, that's an EMS guy, and wants to throw you 1 or 2 bags to carry in your medical kit, I highly suggest you do it. Someone that you only have 8 pints of blood in your body. That's it, 8 pints, and that can bleed out rather quickly. So if you have an IV bag and you have the ability to insert it and use it, get the training and make sure you do it. Splinting real quickly, not overly excessively hard to do. This is a SAM splint. They also come in like a round form. This is the flat one I like better because it's easy to stick in the bag. These are popsicle sticks. So yeah, I got them for $1.99. They are not sterile, but these things work great for broken fingers, broken toes. You know, like I said, you can give them to your kids to play with, put little faces and little hair on it, whatever. But ideally, it's a straight, steady stick. Use it with some tape. I fractured many of fingers in my lifetime, so I know. And at least until you get to the hospital to get x-rays and maybe some more pain meds, okay? Triangle bandages are essential. You can get the old military style, or you can get these Dynex. You can buy these in boxes of 20 now. They're very cheap, very usable. I just helped some kid out that I think he was like a baseball player or something. He was on a diamond. He was, you know, hurt, and I had my medical kit. And what happened was he actually popped his elbow out throwing the ball. That's how fast the guy. And the only way that we can get him off the mound was to use a triangle bandage, put his arm over his chest, and of course it was excruciating painful, but it popped out. You have to take the arm or the joint or whatever the case is, you know, try to stabilize it into one position until he gets to the hospital. And that's what we did, and we used triangle bandages to do that. You could also use them for head wraps, you can use them for bandages, you can use them to hold on stuff, you can even use them for field expedient tourniquets if you need to. Buy cold packs. These things, this one's just a small one, but again, these things are awesome. They last a very long time, and you can buy them on Amazon relatively cheap. Okay, they're not that expensive. These are the ones you just pop, put it on, and then once they're done, you dispose them. They're great. Buy as many of those you can, especially if you have children, because those are the ones that are going to be beating their legs, their knees, their hands, their heads, you know, whatever. Put a cold pack, put something on there, get some ice on it, you know, and you're good to go. Alright, before I talk about, again, something a little bit more advanced, a little bit of suturing, I can tell you right now that I do not believe that you should do sutures in the field unless you absolutely 100% have to and you know what the hell you're doing. You could wind up destroying more skin around the wound than actually helping out the patient. What I like to do is I will use either what they call butterfly sutures or the tape version of sutures and tape that thing tight, because in a sterile environment it's easy to do sutures. In a dirty environment such as outside, it is not, and you might wind up giving them more infection or destroying more skin tissue depending on how bad the cut is. So a lot of people say use super glue. You absolutely can, but you know, again, the wound has to be cleaned out. These are readily available. These are Suture Kits. These are Bronmids. It's just a needle and some thread. Excellent. I know a lot of people will carry the Disposable Stapler. Again, not bad. You're using staples, but again, if you are going to staple a wound closed, do not do it on their head. Okay, we don't need anybody looking like Frankenstein. And believe me, I've heard of people that wanted to staple someone's head for a suture, and it's like, listen, they got to look at they got to look in the mirror for the rest of their life. So don't put staples in their head. Use this, use tape or use this. And again, you have a staple remover. I always try to carry some type of disposable scalpel. Again, I'm not doing field surgery, but if you have absolutely need to, you can. This is also really nice. This is a surgical instrument for minor surgeries. This is a doctor's field surgeon kit. You can get them on Amazon. It's got some hemostats in there, some really cool scrapey thingies in there. Look at that. That's looks like a dental tool, and all kinds of instruments that you would need to do field surgery, which I'm definitely against. So, but like I said, if you're out in the wilderness and a bear chews your leg off, you got, you know, all the supplies. You're gonna have to do something. As far as surgical shears, carry them. This one is cheap. It will be replaced. This one is made in Pakistan. Listen, I understand the need to purchase stuff and not need it and have it sit in a car or have it sit in your house or in a mobile ATV, whatever, and you probably never use it. I get it. So they buy cheap, and then, but when you really need it, buy something good. All right, I have a list of the stuff on Amazon store. As far as protecting yourself, you don't have to get the face shields. Some people get face shields, but I like these. This is an N95 respirator. What I like about this is, you see how thin that is? There are a lot of respirators and even N100 respirators that are made specifically for particulates. There's you can go all the way up to NVC, which is made for diseases and that type of stuff. But if you are somebody that's on the road or in the wilderness, you're not going to have access to any of that. And I don't know anybody that carries an NVC kit suit to the woods in their first aid kit. Just doesn't happen. So protect yourself. You can also get safety glasses if you want, if you are worried about somebody shooting blood in your face that you don't know, or, you know, I've been on countless jobs where I have seen EMS and they never wear glasses unless it's to read with. So again, that's one of those things that's your own personal safety. Also, they sell different. N95 is good. N100 is a little bit more, but again, we're talking about packing all this stuff in a collapsible size bag. All right. As far as gloves go, I know, like, these are the ones that I absolutely love. This is Raven. They are nitride gloves. All right. There are also latex gloves, and I don't know, I forget the other name of them, but for me, 6mm nitro gloves are excellent. What I like about them is mostly you can use them for anything. You can use them for healthcare, plumbing, sanitation, painting, and chemicals have a hard time destroying the gloves. Latex gloves, if you put them in, or you use anything like an acetone, or if you use like a gas, or you're working with gas, those gloves will get destroyed. They will actually melt off your hands, so they're no good. Hospitals tend to use a lot of latex-free gloves, obviously because of the allergies. So they don't want people getting sick while they're treating them. Again, make sure you get the appropriate size. I love these gloves. They're about $15 for 100. Now again, like I said, I also carry or have had other gloves. These are latex. Not a big fan of those, but these are awesome. These are 15mm. They're made by Shamrock. I just ordered another. I think I ordered another two. But these are 15mm. They have the extra cuff, so you can see how long they are. All right, so they're very long. It will cover the wrist, and because they are thicker, they will help. They're not going to rip as easy. Okay, but again, for the same price, you're only getting 50 because they are thicker. So you're getting less for the money, but If you are somebody that's really worried about, or you work on cars, or even, you know, you're really worried about some type of chemical agent, because don't forget, if you go to like a scene where there's a whole bunch of cars and they're all getting, there's going to be gas and oils and all kinds of crap all over the road. I mean, ideally you don't want to touch it with your hand, but if you slip and fall, you don't want that that grease or whatever it is to be on your hands. Take the glove off, put another one on. However, if you haven't seen it or you didn't know about it, now your gloves are starting to deteriorate, okay, and you really don't want that. Alright guys, so I'm going to finish this here. There's going to be another 2 videos about this stuff. I'm going to go over the actual kits themselves, how to pack them, and I'm probably going to go over a little bit of training stuff as well. So if you're interested, you know, please like, subscribe, tell me what you think. I think I've covered almost everything that should go inside a medical kit, an extensive one. And if you're interested, please go up to 3riverblades.com, support the channel, and talk to you soon. Stay safe out there. Thanks.